arterial disease in the legs or lower extremities is the narrowing or blockage of the vessels that carry blood from the heart to the legs. Lower extremity peripheral arterial disease affects approximately 10% of the American population, with 30% to 40% of these patients representing with claudication symptoms. Peripheral arterial disease increases with age and the number of vascular risk factors. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Rivaroxaban and today I'm going to discuss about peripheral arterial disease, its complications in venous thromboembolism and its treatment by Rivaroxaban. A new cohort study found that 6,564 patients undergoing lower extremity revascularization for peripheral arterial disease, the 3-year rate of venous thromboembolism or VTE in patients receiving placebo was 1.66% and low-dose Rivaroxaban plus aspirin was associated with reduced risk for venous thromboembolism. Previous studies have observed an association between the burden of atherosclerotic vascular disease and the risk of venous thromboembolism. The association is not known in peripheral arterial disease after lower extremity revascularization. The study was a global multi-center cohort study that used data from the vascular outcomes study of ASA along with Rivaroxaban in endovascular or surgical limb revascularization for Voyager PAD randomized clinical trial, which enrolled patients from 2015 to 2018 with median follow-up of 28 months. Participants included patients with peripheral arterial disease undergoing lower extremity revascularization. Patients with an indication for therapeutic anticoagulation were excluded. Data were analyzed from September 2020 to September 2021. Randomization to Rivaroxaban 2.5 mg twice daily or placebo on a background of aspirin 100 mg daily, short-term clopidogrel was used at the discretion of the treating physician. Among 6,564 patients, 66 patients had at least one venous thromboembolism. The 3-year rate of venous thromboembolism in patients receiving placebo was 1.7%, hypertension was 2.11, prior to amputation 2.07, and older age 1.81 were associated with increased risk of venous thromboembolism. Venous thromboembolism was associated with risk of subsequent mortality of 7.22. Compared with aspirin alone, Rivaroxaban plus aspirin was associated with lower venous thromboembolism risk of 0.61, with benefit apparent early and sustained over time. This association was not modified by use of clopidogrel at randomization without clopidogrel 0.55 with clopidogrel 0.69. Researchers conclude this study there was continuous risk for venous thromboembolism after lower extremity revascularization in patients' peripheral arterial disease. Low-dose Rivaroxaban plus aspirin was associated with lower venous thromboembolism risk compared with aspirin alone, with benefits apparent early and continued over time. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.